Uh, so nice to meet you all. So today I'm going to talk a little bit about the overview of like brain cancer management. So let me just share the slide. Let me see. Let's try this. Can you all see the screen okay? Can you all see the screen okay? I'm not sure I can hear you guys.
Yes.
Okay, great. All right. Thank you so much. So sounds like it's a relatively small group. So, feel free to interrupt me at any point to if you have any questions. So, again, I'm Dr. Keng Lam, one of the neuro-oncologists at CDA Hope. We're located in Dorothy, and basically, my job is I'm a physician who's a neurologist trained who treat brain cancer. And today, we're going to do a very broad overview about brain cancer in general. So I want to really plug in about our team here. So treating brain cancer is a truly a big multidisciplinary. They require a big multidisciplinary team. So we have our wonderful neurosurgeons who manage a lot of surgeries, near resections, and post-op complications. We have our radiation doctors, our neuroradiologists, and then our pathologists, and of course, on the more kind of personal touch, we also really treat our patient in terms of 360 degrees. So we really care about their everybody's psychosocial situation. So we have a very robust social services program as well as our couple program that really help navigate the the people and their partners and their family through the process. So first of all, what is brain tumor? So to really put it brainly, brain tumor is really referred to an abnormal mass in the brain, and a normal mass in the brain, it could be malignant, which is basically means that is this cancer. It is something that can continue to grow and potentially spread to other parts of the brain. Or it could be non-malignant, which just means like benign. So it's usually something that doesn't grow rapidly, it doesn't spread anywhere else. And in almost all the cases with brain cancers, there's nothing really the person did individually that really caused the brain cancer. Most of them are really what we call sporadic. So it's not really caused by anything, any actions or anything in particular. So, brain cancer, there's really separate into two categories. So, one is the primary brain cancer. So, primary brain cancer refer to usually that the cancer originated in the brain. So, some of the abnormal cells in the brain, let's say such as the glial cells, they can become gliomas, which is a tumor, and they can become aggressive type of tumors such as glioblastoma or astrocytoma. These are what we usually call the primary brain cancer, and they are usually do not spread to other parts of the body. They usually stay in the brain. So that's why we don't really call them stages. Stages refer to when we stage something when the cancer spread to other parts of the brain, other parts of the body. So it's not really staging that we use for primary brain cancer. Now there's also something called secondary brain cancer. And the other word for that is called brain metastasis. And that's when cancer from other parts of body spread to the brain. Sometimes it can be just one solid lesions. One sometimes can be multiple lesions in the brain. So we call that brain metastasis. So very common cancers such as the lung cancer, breast cancer, and skin cancer, melanoma are particularly very prone to go into the brain. And if you look at the data, I know this is a very busy chart. The In terms of the primary brain cancer or primary brain tumor, the primary brain tumor, meningiomas is probably the most common one. Meningiomas refer to when there's a layer that wrap around the brain. Is called to protect the brain. We call that the meninges. That's when it starts to grow. We call that meningiomas. In most cases, they are considered to be benign, and a lot of people may live. Most people probably live through the entire life without knowing they have a meningioma. But in some cases, they can grow and somewhat grow rapidly and become malignant. And probably the most common malignant brain tumor we have is the glioblastoma, which is usually affect more for people who are older in the 50 or above, 50s, 60s, and 70s and above. And the incidence for brain tumor usually is higher in males and higher in people who are white. And they are considered to be probably the fifth most common brain cancer, and about 1 million people are living with this diagnosis every year, and we see a lot of them here in Southern California. And then we certainly have a lot of experience in treating for people with primary brain tumor here at City of Hope. And as I mentioned, the other type of category is a secondary brain cancer. We call that metastasis. Metastases are certainly much more common than what we call primary brain tumors. So if you look at the chart, 15% are primary, but then the 85% are metastasis. If you really look at if you look at in terms of the breakdown for people who have some sort of brain tumor, and people who have cancer from other parts of body like breast cancer, lung cancer, about 10 to 25% of patients can develop brain metastasis. So it's very common. And sometimes in rare cases, we even see people who present with tumors, cancer spread to the brain as the first sign of their cancer diagnosis before we realize the cancer is actually coming from other places like lung, breast, or melanoma. So what are the most common signs and symptoms for the brain cancer? So it can also depends on where and which part of the brain it gets affected. But probably one of the most common one presentation for brain cancer is a new type of headache. So if you are somebody who prone to migraine and then you getting the same type of headache every time, that's similar to a migraine you had before, it's pretty unlikely it's a brain cancer, especially if you already have some sort of head imaging before. But if it's like new type of headache or that you never had before is a very intolerable headache, then you should really seek medical attention right away because it could be signs of hair bleeding, or it could also even be signs of new presentation or brain tumor. Seizure is also very common presentation for brain tumor, difficult talking, um, as well as memory problem. When the memory problem is usually more manifest within the weeks and months of pretty rapid progression, that's when we're really concerned that the person should really get head imaging. Weakness or numbness in big part of your arms or big part of your leg, or even sometimes people have a lot of headache and nausea, and there's no very good explanation. That can be also early sign of a brain cancer. So how do you diagnose this? Probably the most common way to diagnose for brain cancer is really head imaging. So head imaging could be a CAT scan of the head, so CT head, or could be an MRI of the brain. If you have a sudden onset of presentation of neurological symptoms when you present in the emergency room, they most likely will be starting with a CAT scan of the head, which for the most part can detect, if it's a brain problem, most of the time it can detect what was wrong with it. But in some cases, we might need detailed pictures. Then sometimes we need to get an MRI as well. So once we get an MRI or CAT scan and we realize there's a mass there, and if it especially causes symptoms, that's when the neurosurgeon will comes in and either do a complete resection of the areas to cut off the tumor, or if it's a tumor is located in the part of the brain that is not very safe, then they might do, let's say, a biopsy just to get the tissue to test to see what kind of cancer we're dealing with or what kind of tumor we're dealing with. In very rare cases, we might do a spinal tap, which is where you use the needle in the lower back and then take some of the fluid out for study, but that's usually a little bit less common in the early stages of diagnosis. Either way, if it's something that looks aggressive or causing a lot of neurological symptoms, the the surgeon usually need to get involved in terms of either doing resection or biopsy. And in both cases, we are able to get tissue to really test it out to see what type of tumor that we're dealing with. And that will really help us guide us information about the prognosis and treatment options for this for the scenario. And as I mentioned before, in terms of treating brain tumors, probably the if it's causing a lot of symptoms, it's big enough, then surgery usually needs to be done in order to really relieve the symptoms and prevent any further neurological decline. And if it's something that is considered to be malignant, or aggressive, then oftentimes they will need radiation. So radiation doesn't need to be something like a whole brain radiation, and most of the times can just be a focal radiation to the area around the area where the tumor was affected in the brain. And it depends on the scenarios or what type of tumor it is. Sometimes the person may need chemotherapy or some sort of targeted drug therapy to really arrest and prevent further growth of the tumor. And of course, a lot of times it's very important to consider any options for clinical trials, especially when the tumor comes back despite the frontline treatment. So that's why I think when going to a tertiary academic medical center, it's very important to really establish care and to consider to see if there's clinical trial options that might be available to them. And then just very briefly, so the cancer can go into the brain, specifically the brain itself, but then the brain itself may also have the layers wrapping around the brain, and also the fluid that bathing the brain. We call that cerebral spinal fluid, also known as the CSF. And sometimes the cancer can spread to the fluid itself, not just the brain itself. And that's when it really need to do rapid diagnosis and treatment because the prognosis tends to be a little bit more challenging and the treatments also tend to be slightly more limited, and then things can change very quickly, so it's very important to make that diagnosis quickly. And leptomeningeal disease is something that usually present very similarly to brain tumor in general, so something is often needs to consider as well. So, like mentioned before, brain tumors can be a very tricky business because you need a surgeon to kind of decide whether or not surgery is a good option for you. You might need to involve the radiation doctor to decide whether or not radiation makes sense to you. And of course, you may or may not need an oncologist, specifically a neuro-oncologist, who decide whether or not some sort of drug therapy, the chemotherapy or targeted therapy can be helpful to you. So the medical decision making can be very complicated, complex, and it's not just necessarily a simple linear flow chart decision. Sometimes it can be depend on a lot of um, kind of subtle detail. So it's when you go to a brain tumor center like CDO Hope, it's really a multidisciplinary team that we really work together and really have a understanding and have a consensus about what to do with the treatment. And of course, the specialists here, they see brain tumors every hour of the day. So they really understand how to treat brain tumor, and they're very experienced about that. And of course, sometimes, you might decide to seek to see if there's options for clinical trials, or sometimes even what we call standard of care. So the treatment that you get at the every other places can also be optimized to really make sure that you benefit from it as much as we can. So that's really the overview for kind of brain tumor or brain cancer in general. Um, if you have any questions, you're always welcome to reach out to me, or if you want to have people that want to see brain tumor specialists for second opinions, I'm always happy to accommodate that as well. So that's the gist of my talk, and I'm happy to let me stop sharing. I'm happy to kind of see what questions you all may have. I think you're kind of muted, just letting you know. So in case somebody's talking, maybe you didn't. Okay, any questions I can answer you all? Oh, I think you're muted. The person in the room, the facilitated room, I think you're muted if you're trying to ask a question. Okay, let me get on with further questions, and let me put down my email address at the group chat in case you need to reach out to me. I'm always happy to answer that.
I have a question.
Yes.
What's the prognosis of the glioblastoma? How many years, span of years for patients, to survive?
Yeah, that's a great question. So, glioblastoma is probably the most aggressive type of primary brain tumor, and the prognosis can be variable, depends on the person's fitness, about the specific tumor markers and their tumor. But generally, we say it's about less than 2 years for glioblastoma prognosis wise.
Thank you.
You're welcome.
Okay, another question. For the kids, they have this tumor. I forgot the exact name.
For
And
the what?
for the kids, they
Okay, what about pediatric?
yeah, because I have a friend, her son. I forgot the name of the tumor that he has. Well, I guess they have different kinds of tumor. Do you take care of pediatric too?
So I don't typically take care of the pediatric as much. Usually I took care of people who either who was diagnosed as a pediatric, and then with a brain tumor, and they grew up to be adult. Sometimes I see some of them, or maybe sometimes we see some of the younger adults who were diagnosed with a pediatric type of brain tumor, which also happens as well. So I usually see people age 18 and older for me. I have other colleagues who are the pediatric oncologists who they're the one who see more the pediatric brain tumors. And sometimes if they have questions or they need help, they also reach out to us and we can potentially collaborate.
Okay, thanks.
Yep. You're welcome. Alrighty. Okay. Well, thanks so much for coming to the talk. And if you ever have questions, need to reach out to me, feel free to let your the organization know, and they will find a way to reach out to me as well. Okay.
Thank you so much, Dr. Lam. I really appreciate it.
You were welcome. Okay. Thanks so much. Have a good afternoon. Bye
Bye,
bye.
everyone.